Hello my dear doctors, welcome back. Let's continue with the next topic in the cardiovascular system embryology. Now in this section we are going to learn about the development of arterial system, where I am going to teach you about the development of all the arteries. Of course the main one, arch of aorta, and all the branches of that, common carotid, internal carotid artery, external carotid artery, brachiocephalic, subclavian, all those we are going to learn right now. But before starting to learn about the development of the arterial system, we need to learn the orientation. I have seen in many live classes, students don't understand what exactly is the orientation of this diagram, how we are exactly seeing it. Now, listen to me very carefully for the first 2 minutes. Why? Because orientation is important. If you learn this, then the entire topic will become damn easy. Now, you all know very well this diagram here. This is the diagram of the embryo, developing embryo. And in this, we have already completed in detail the development of heart. And when I taught you about the topic of development of the heart, in that I told you that the cranial most part will be the truncus arteriosus. In that heart tube, the cranial most part will be the truncus arteriosus. Then cranial to that one, you will be able to see the aortic sac. There will be aortic sac. Be careful, it's not aortic sinus, it's aortic sac. Cranial to the truncus arteriosus. So that is cranial to truncus arteriosus means what? It means it is along with your heart tubes, so it is more ventrally present. Whereas you actually have the dorsal aorta, you are able to appreciate here, you are able to see in this diagram, there will be two dorsal aorta actually, right and left dorsal aorta. Name itself is telling you it's dorsal aorta and they will be actually present behind. So suppose you just imagine myself to be an embryo. If I am an embryo like this here, so heart is developing here and there is an aortic sac here ventrally. And then you'll be having the right dorsal aorta and there'll be a left dorsal aorta. Now, it doesn't make any sense if they are not connected. They have to be connected. So therefore, the aortic sac in the front is connected to the dorsal aorta behind with the help of 6 arch arteries. You remember in head and neck embryology, we have learned about the pharyngeal arches. Initially, you'll be having like 6 pharyngeal arches, and all those 6 pharyngeal arches will have an artery, arch artery, pharyngeal arch artery. So there'll be 6 arch arteries connecting to the dorsal aorta on the right side, and similarly there will be 6 arch arteries connecting to dorsal aorta towards the left side. That's the exact arrangement that you have to understand here. So you're able to appreciate here, this is the dorsal aorta here, and there will be another dorsal aorta here, and you can clearly see there is an aortic sac here, and they are connected by the 6 arch arteries. Now this is actually a side view of the embryo. Let me show you exactly from the front. This is how the diagram looks like. I'm pretty sure you have seen this diagram a lot of times in your embryology. So this is aortic sac here having 2 horns, the right horn and the left horn. And then you're able to see the right dorsal aorta, and then there is a left dorsal aorta. And all these are the arch arteries. So there will be totally 6 arch arteries connecting that with the dorsal aorta. Now once you understood the orientation here, now it will make sense to learn about the development of arteries. So now let us see which artery will be developing from which pharyngeal arch artery. Let's do that. And that too, I'm not going to teach you with the help of this complicated diagrams over here. Let's draw our schematic diagram here, guys. So I request all of you to please draw the diagram exactly as I'm drawing. Let's make this entire topic simple. First of all, imagine this one here to be the right dorsal aorta. And imagine this one here to be the left dorsal aorta. Right dorsal aorta, and this one here will be the left dorsal aorta. Of course, the name is indicating that it is present behind. Now, what do you have in the front here? On the ventral aspect, you have got aortic sac. So imagine this one here to be the aortic sac, and aortic sac will actually have the 2 horns, the right horn and the left horn. I request you not to write down the nearby. Why? Because there are so many arteries and so many structures going to come there. So please write it a little bit away here. AS stands for aortic sac. Perfect. Now how is this aortic sac joined along with the dorsal aorta? With the help of arch arteries. And how many arch arteries do you have? 6 of them. So this will be the first arch artery here, second arch artery, third arch artery, the fourth arch artery, fifth arch artery, and the sixth arch artery here. And exactly the same on the other side also. the first arch artery, the second, third, the fourth, fifth, and finally the sixth arch artery. Perfect. So instead of that complicated diagram, try to practice this diagram. I am telling not to just mug up, learn, concentrate on my English, practice this diagram. Things will become damn easy. Now once the entire platform is ready, now let us see which arteries will be developing from where exactly in an easy manner. And first of all, let's get started with the biggest one, the largest one, that is arch of aorta. Apply common sense, guys, right from first year onwards. Arch of aorta we have been drawing towards the left, at least in our diagrams in books and all, towards the left. So therefore, arch of aorta will be developing from number 1, aortic sac, number 2, the left horn of the aortic sac, and then the left fourth arch artery. Be careful with the naming there, nomenclature. It is fourth arch artery, that too towards the left side, and then a part of left dorsal aorta. Wow. So you can clearly see there is an arch formed there. Just look at the diagram and write down. No need to mug up at all. So let us even write down the note simultaneously. Arch of aorta will be derived from where? Number 1, it is derived from aortic sac itself, along with the left horn of aortic sac, and even the left fourth arch artery, and then the left dorsal aorta. Hope you will be 100% agreeing with me. There is no way that you can just simply mug up this one and remember for long term. No way. This diagram should be like printed in your mind step by step. Then only you will be able to answer the MCQs based on this diagram. Otherwise, there is no way mugging all these things. You yourself will agree by the end of this topic. Now, once you are comfortable with the arch of aorta, let's start with the branches of the arch of aorta, guys. Hope you all know there will be like 3 branches of the arch of aorta. Towards the right, there will be brachiocephalic trunk, or we can say brachiocephalic artery. And then towards the left, you'll be having the left common carotid artery. And then there will be left subclavian artery. Left subclavian artery, left upper limb there, left common carotid artery toward the head and neck. But what about the right side, sir? Right side, right common carotid, right subclavian, both of them will be the branches of brachiocephalic only. We have been learning this from the first year MBBS onwards. That's why the name is given as brachiocephalic. Brachio, brachium, limb, upper limb, cephalic, head and neck part. So it makes sense. It's so easy to remember. And now one more thing easy to remember. After recalling the gross anatomy in our mind, let's compare that gross anatomy with the embryology here. Brachiocephalic trunk towards the right. It makes sense. Brachiocephalic trunk is going to develop from the right horn. Brachiocephalic trunk is derived from where, sir? The right horn of aortic sac. So let me just write down here. Brachiocephalic artery. Brachiocephalic artery, this is the one which will be derived from where? It's derived from the right horn of aortic sac. That's all. Only the right horn of aortic sac. That's all. Perfect. Now, what is the next branch of arch of aorta that we have to learn after brachiocephalic artery? The next one is common carotid. Left common carotid, of course. Left common carotid artery, it will be a branch of arch of aorta only, and that is derived from third arch artery. Common carotid artery is derived from third arch artery. But I would like to tell you something over here, guys. During our MBBS days, we have learned that common carotid artery will go up and divide into internal carotid and external carotid. It's wrong. Absolutely wrong. The right way of learning that is common carotid artery will go up and then it is going to give rise to external carotid artery, a branch that is external carotid artery, and then the common carotid artery will continue as internal carotid artery. So don't learn from today onwards that common carotid artery is dividing into internal and external. No. Common carotid artery will give a branch that is external carotid artery, that itself will continue as the internal carotid artery. So therefore, my dear friends, this common carotid artery will give a branch here, or it will give a bud here, and that bud is developing into external carotid artery. And further, it will continue as your internal carotid artery. So let me just write down here. This one is common carotid artery. This bud here is going to form external carotid artery, and remaining here will be your internal carotid artery. So the moment you look at my diagram there, you will be easily able to understand common carotid artery is derived from where? Common carotid artery, it is derived from where? Third arch artery. But is it the complete third arch artery? No, only the proximal part. So I'm just telling you a little bit slowly here. Try to understand aram se, coolly once, then it will be easy for you to recall. Common carotid artery is derived from third arch artery, but is it the complete third arch artery? No. It is just derived from the proximal part of that one, proximal part. Similarly, internal carotid artery is derived from the distal part of third arch artery as well as dorsal aorta. And exactly the same on the other side also. What about the right common carotid artery? First thing we all know, right common carotid artery is a branch of brachiocephalic only. So it should begin from here only. Brachiocephalic trunk, and from the brachiocephalic trunk, remember, yes, again the same thing, proximal part is going to form the common carotid artery. It will give rise to a bud-like structure going to form external carotid artery, and then distal part is going to form internal carotid as well as dorsal aorta is also going to form internal carotid there, guys. Perfectly done. Perfectly done there, guys. Okay, so let us just simultaneously write down the notes also here. Common carotid artery, it is derived from proximal part of third arch artery. I'm just writing in short as third arch artery. Internal carotid artery, it's derived from the distal part of third arch artery, and along with the distal part of third arch artery, even the dorsal aorta. Even a part of dorsal aorta. But if you are observing properly there, guys, I am not at all writing there as right or left. So if you are observing properly there, I am not at all using the word as right or left there. Why? Because it is the same on both the sides. Understanding? So therefore, you don't have to separately write down there as, right third arch artery or, left one. So it is the same on both the sides. Now, once you are done with the carotid arteries, now the only thing that is left out is subclavian artery, and that is extremely important for exams. Why? Because subclavian artery is not derived from the same structures on the right side and left side. It is different on right and left side. So I want like more concentration here, guys. Now, dorsal aorta will actually give rise to a branch here. Now, what is the name of this artery? Let me tell you here. The name of this artery is actually intersegmental artery. It is actually the intersegmental artery. Now, dorsal aorta, whether it is right or left dorsal aorta, they are going to give rise to many intersegmental arteries like cervical, thoracic, lumbar. Many intersegmental arteries are given on the sides. I have not drawn all of them over there. The diagram will become like more complicated unnecessarily. But you just remember one of the intersegmental artery. Okay, fine. This is like which one? It is 7th cervical intersegmental artery. Of course, towards the left side. So what is the complete name of this one? It is left 7th cervical intersegmental artery. Intersegmental artery. Left 7th cervical intersegmental artery. And the moment you look at my diagram over there, you can easily understand that left 7th cervical intersegmental artery, you can appreciate that it is a branch of your arch of aorta only. That's the reason why, my dear friend, it has to form your left subclavian artery. So it is the one which is going to form the left subclavian artery there. So left 7th cervical intersegmental artery, it is the one which is going to form left subclavian artery. That's all. Crystal clear concept. So by this, I am done with the largest one, that is arch of aorta, the 3 branches of that: brachiocephalic, left common carotid and left subclavian. Now the question mark here is, what about the right subclavian? Right subclavian artery is derived from where? One thing till now, if you people are understanding along with me, if you are understanding this concept crystal clearly along with me, you clearly know that right subclavian artery is definitely a branch of brachiocephalic only. So brachiocephalic artery will actually give rise to a branch here that is derived from the right 4th arch artery as well as the right dorsal aorta, and not only that, also from the right 7th cervical intersegmental artery. And for sure, that is the one which has to form your right subclavian artery. So right subclavian artery is actually derived from three sources. It is derived from three sources. Number one, right fourth arch artery. Number two, right dorsal aorta. And number three, the right seventh cervical intersegmental artery. Let us write down here. So right subclavian artery is derived from three sources. Let me write down with the same numbers here. Number one, it is right fourth arch artery. Number two is actually the right dorsal aorta. And number three, there is right seventh cervical intersegmental artery. So exactly, this is the thing that I was actually telling you about, that I was actually referring to you about. So you can now clearly compare there. There is a lot of difference between development of right and left subclavian artery. It is different on the right side and left side. That is the reason why it's most commonly tested in your exams. Now again, going back to the very beginning of this topic, when I told you the orientation, exactly how it is oriented, try to recall that in your mind. Aortic sac will be in the front, and then the right dorsal aorta and left dorsal aorta will be present behind, connected with the help of arch arteries. Fine, lovely. At the same time, simultaneously, what is going to happen is that even the respiratory buds, which are developing from your foregut, I told you already about that the esophagus, foregut is going to form your respiratory buds. So even the lungs are also forming at the same time in the middle. So ventrally you have got aortic sac, dorsally you have got the dorsal aorta. At the same time, simultaneously, what is going to happen? Yes, lungs are also going to form there. So just try to remember something like this. Even the right and the left lung or lung buds, whatever you can say, respiratory buds are also going to form. Now lungs will be supplied by pulmonary artery, and pulmonary artery will be actually derived from the sixth arch artery. The sixth arch artery. And of course, till now you have learned like derivative of so many arteries over here, and you already know the method. It's not the complete sixth arch artery, it's only the proximal part. So this is the pulmonary artery on the right side over here, and this is the pulmonary artery towards the left side here, and those two, both of them are derived from the proximal part of sixth arch artery. Let's just write it and finish it off. So pulmonary arteries, they are derived from the proximal part of sixth arch artery. And again, I hope you are observing carefully there. I am not using the right or left. On both the sides, it is from the proximal part of sixth arch artery only. One more thing which was recently tested in the exam, what about the ductus arteriosus? Now, I want you all to apply the common sense here. So many things over here. I think now you'll be able to apply the common sense. Ductus arteriosus is derived from where? Okay, just look at our simple diagram here and try to answer yourself. Just try to recall in your mind, ductus arteriosus is present between what? The ductus arteriosus is between pulmonary artery and arch of aorta. Pulmonary artery and arch of aorta. Arch of aorta is definitely towards the left side there. So therefore, ductus arteriosus cannot be towards the right. It should be definitely towards the left side only. And that too, yes, the ductus arteriosus will be between the pulmonary artery and arch of aorta. So it has to be derived from where only? The sixth arch artery only. Why? Because it is between pulmonary artery and arch of aorta. Sixth arch artery. But again, the same question, is it from the complete sixth arch artery? No. Only and only from the distal part of the sixth arch artery. Okay. So therefore, let us just write down here, ductus arteriosus. Ductus arteriosus. This is derived from the distal part of sixth arch artery. Ductus arteriosus derived from the distal part of sixth arch artery has been recently tested in your exams. So my dear friends, with the help of this simple diagram, you will be able to learn the derivatives of each and every artery, guys. Each and every artery, and no need to mug up at all. I think now you will 110% agree with me. There is no question of mugging these things. If you mug up this one, you will not be able to remember. There is a lot of confusion, right, left, and then the number of arteries, like which artery and all. So you will not be able to mug up this one. Best way, as I said, you practice. Take a rough paper, pen, practice this diagram like 2-3 times, and things will become easier. Then what else? What about the remaining things? I hope you are even understanding why did I draw the diagram in the dotted lines. Why? Because whatever is drawn in the dotted line over there, it will be actually either the remnant of that, or we can say it is actually degenerated, it's gone. So you can see the number 1, number 2, number 5, nothing. Okay, number 1, number 2, number 5, we are just left out of the dotted lines only. Okay, so let us do one thing. Out of all that 6 arch arteries, let us just make a table here and write down what is exactly developing from all the 6 arch arteries. The pharyngeal arch number, pharyngeal arch, and then on the other side let us write down it is forming like which arteries. So in head and neck, when we have learned about the pharyngeal arches, there I made you learn about the derivatives like which bones, ligaments and muscles are derived from the arches. And right now in this topic we are going to complete that, like which arteries are derived. It is more better to learn here. If I teach you the same thing, or if I make you learn the same thing in head and neck topic, head and neck embryology topic, it's waste. You'll not be able to correlate. Now it is a perfect time to learn about this one. Pharyngeal arch number 1. Yes, it is the one which is going to form your maxillary artery. Maxillary artery. Now don't get confused here. Maxillary artery is one of the branch of external carotid artery only. External carotid artery, it's developing from where? It's actually like a bud, given like a bud from the common carotid artery. Okay, that is coming from the third arch artery. Even though it's coming from there, the remnant of the first one, here, the first arch artery is nothing but your maxillary artery. Maxillary artery. Then what about the second arch artery here? The second arch artery, it is the one which is going to form your stapedial artery. Second arch artery, it is the one which is going to form stapedial artery and hyoid artery. Stapedial artery and hyoid artery. Then arch number 3, we have already seen just now, it is the one which is going to form common carotid artery as well as the internal carotid artery. Arch number 4, towards the left it is going to form arch of aorta, and towards the right it is the one which is going to form your subclavian artery. So arch number 4, the arch artery is going to form, left fourth arch artery is going to form arch of aorta, and the right fourth arch artery is the one which is contributing for the formation of subclavian artery. And number 5, the fifth one, it is the one from where no artery is developing, guys. So therefore it is degenerating. It is gone, it is regressing. It degenerates. No artery is derived from the fifth arch artery. And lastly, finally, the sixth arch artery, it is the one which is going to form pulmonary artery. And not only pulmonary artery, even the ductus arteriosus. Ductus arteriosus between that pulmonary artery and the arch of aorta towards the left side. But we all know very well it is during development only. But after development, what is going to happen? The ductus arteriosus is closed, and right now in your body and my body, it is in the form of a ligament, ligamentum arteriosum. So in some unfortunate people, it fails to close, it fails to obliterate, and there will be a patent ductus arteriosus condition. I hope you will be able to correlate that. Then apart from this, I want to tell you about one more important MCQ which was recently asked. Okay. So again the same thing, just very quickly let us just draw the diagram again. This is the right dorsal aorta and this one is the left dorsal aorta. And now I want to teach you something more here. The right and the left dorsal aorta in the caudal end, they are going to fuse together. The right and left dorsal aorta and the caudal end, in the lower end, they are going to fuse together. Imagine this one to be the aortic sac. Aortic sac will be having two horns, the right horn and the left horn. Just now I taught you aortic sac, the left horn and left fourth arch artery and a part of dorsal aorta. That is going to form arch of aorta, and that arch of aorta will further continue down as descending aorta. So now let me even teach you further in depth. Descending aorta is derived from where? Descending aorta will be derived from the caudal part of left dorsal aorta as well as the fused part. So till here this one is actually the arch of aorta, and we don't have to write down again it is derived from where. Now remember about the descending aorta. Descending aorta will be derived from where? Number 1, I can clearly see here itself, caudal part of left dorsal aorta. And not only the caudal part of left dorsal aorta, even the fused part of dorsal aortae, both of them. of dorsal aorta, both right and left one. That's the one which is actually going to form your dorsal aorta, descending aorta. So that is the beauty of learning with the help of these diagrams here, guys, that we don't have to mug up the things, and forget about mugging up the things, we can't even learn in that way. Caudal part, cranial part, right and left and all. So the best way is learning like this. So arch of aorta already we have completed before itself. We don't have to write down again. It is derived from where? Descending aorta is derived from the caudal part of left dorsal aorta as well as the fused part of both the dorsal aortae. Now there was a question given in the exam. Which was asking about what is the reason for the formation of abnormal subclavian artery? That too right one, abnormal right subclavian artery. First of all, let us see the normal one. Let us recall the normal one. Just now I taught you. The normal right subclavian artery is derived from the right fourth arch artery, right dorsal aorta, and then the right seventh cervical intersegmental artery. That is a normal right subclavian artery. But unfortunately, what is going to happen in some people, the right fourth arch artery will obliterate. Okay, so the right fourth arch artery will obliterate. Just try to apply that practically in your mind. If the right fourth arch artery is going to obliterate, then how come the right subclavian artery is going to get the blood? How come the right subclavian artery is going to get the blood then? There should be some alternative arrangement for that one. Yes, of course. At that time, what is going to happen? The caudal part of right dorsal aorta. Be very, very careful here. Caudal part of right dorsal aorta. That's the one which will be supplying the blood here. And that is the one which is going to contribute for the formation of abnormal right subclavian artery. It is not the normal, abnormal right subclavian artery. So let me teach you in this diagram itself. Abnormal right subclavian artery. This was asked in the exam. What is the reason for this one? Number one, what is the cause for this one here? The cause for this one here is right fourth arch artery obliterates. Right fourth arch artery is obliterating. It obliterates. And because this right fourth arch artery is going to obliterate, then what is going to happen? How it is formed? How is that abnormal right subclavian artery formed then? It is formed by caudal part of right dorsal aorta, and not only the caudal part of the right dorsal aorta, plus the right seventh cervical intersegmental artery. Caudal part of right dorsal aorta and the right seventh cervical intersegmental artery. Together, they are going to actually form the abnormal right subclavian artery. Hope the concept is crystal clear. But remember, all these things is happening only because of, yes, obliterated right fourth arch artery. That's important. If the right fourth arch artery is obliterated, then what is going to happen? Yes, it will lead to the formation of abnormal subclavian artery. No confusion at all. Now, there is one more abnormality that you have to learn, which is most commonly asked in the exam, has been asked like many times, even like image-based question also it has been asked, about the double arch of aorta. And I think now I don't even have to tell my students how come double arch of aorta is forming. Double arch of aorta is going to form due to persistent fourth arch artery on both the sides. Both the sides, it is persistent. And not only the fourth arch artery, even the caudal part of both the sides is going to persist. See, normally what should happen? Normally only the caudal part of the left dorsal aorta, only this should be present there, forming descending aorta. If this is also present and even this is also present over there, I mean to say right fourth arch artery is also persistent and even the right caudal dorsal aorta is also persistent. Double arch of aorta, guys. So let us just write down here double arch of aorta. Double arch of aorta. Why? Why do you see this condition here? Why? Because persistence of both fourth arch artery, I mean to say both right and left fourth arch artery, persistence of both the fourth arch artery, as well as persistence of both caudal dorsal aorta. So persistence of both the fourth arch arteries as well as the persistence of the caudal part of dorsal aorta, that is going to form actually the complete like double arch of aorta is formed there, guys. So that is one more anomaly, one more abnormality that you have to remember here. So one thing which is already asked image-based question in your exam, that is double arch of aorta, and second thing that is already asked in your exam, abnormal subclavian artery. And the normal development I have explained you like crystal clearly with the help of this diagram. Hope the entire concept is like crystal clear now. So that is all about the development of arterial system. Then we'll see the development of the venous system in the next segment, guys. Thank you.